For some, it's the big question. How do I know if there's an issue here, or if we should just keep trying to conceive on our own? And whether it comes as a surprise or is something you've suspected you'd need for some time now, the initial evaluation with a fertility doctor can feel intimidating before you even get to the clinic. Well, today we're going to learn all about what to expect. What is infertility, and what is it like to see a doctor and get evaluated? And we're going to do it with the help of an expert.
Hello, my name is Mark Gualtieri. I'm one of the physicians at IVF Florida.
Before we dive in, I just ask that you like and subscribe. And if you want to talk to your employer about bringing fertility coverage to your workplace, we have resources for you at progeny.com/talktohr. Okay, the first big piece of this puzzle is, well, when should you pull the trigger and go get help from a fertility doctor?
There are several reasons somebody might need to see a fertility specialist. If you are 35 or younger and you've been trying for a year to get pregnant unsuccessfully, or if you're over 35 and you've been trying for 6 months. We do recommend somebody over 40 to seek at least a fertility workup, as you're trying to get pregnant sort of from the start. There are several other reasons to seek fertility care, such as previous cancer treatments, same-sex couples, sometimes when you have seen your OB and they've tested for positive genetic diseases, or you're worried about passing along something in your family. Also, if you have a known male infertility, such as low sperm count or difficult to get erections or ejaculation. And finally, if you cannot time your intercourse, meaning if you're ovulating irregularly or maybe not getting periods at all, you should seek a fertility specialist.
Let's unpack it. What is the initial visit like? And what are the doctors looking for?
How do we optimize you? How do we put you in the best position to get pregnant? So the hormones that we get, the blood panel, is going to be really based on your clinical history. The other thing we do is a baseline ultrasound to look at your ovaries as well as your uterus. And then finally, a semen analysis. Now, there are more evaluation techniques such as a hysterosalpingogram, a saline-infused sonohysterography, or other more in-depth evaluation, but you'll talk to your fertility provider about those.
All of the testing and conversations during this process leads to a new conversation about the next steps.
Once we go through these tests, there are many different avenues you can take for treatment. One of them is just optimization. Right? How do we give you supplements or medication or lifestyle to get you to ovulate consistently and put you in the best position to get pregnant? Sometimes there's low complexity treatment that we'd have to do, which is something like an intrauterine insemination, which is essentially you trying to get pregnant on your own, but we make every part just a little bit better, such as giving you oral medication to stimulate a more robust response from your pituitary. Timing with monitoring, so we know that the timing is perfect, and then finally an insemination where we actually get the sperm into the uterus as close to the egg as possible. For more complex treatment, if needed, we'll do in vitro fertilization.
You just heard a bunch of different options that will come up during the initial evaluation process. It's important that you go into this knowing that your doctor is not there to force you into anything, so don't hesitate to seek help because you're worried about what will come next. You will always maintain control.
I think several people get a little bit of anxiety when they just have to make that initial step to see your fertility provider. But rest assured, we just make recommendations, right? We will take your full case and we'll individualize you to say, okay, what do we think the best treatment is for you? But there are several options, and the best for me as a provider is not necessarily the best for you and your family. So I think information or knowledge is the most important thing that you can have. So I really recommend to at least start that journey, and at any point, the options are up to you.
Thank you for taking the time to watch this video. If you like hearing from the world's best doctors, please leave a like and subscribe to the channel. And if you want to learn more about Progeny, visit progeny.com/education. Finally, if you want to learn how you can help bring fertility benefits to your workplace, check out our resources at progeny.com/talktohr.